I chose movement disorders, which is a subspecialty within neurology, because it's a very clinical field. It requires close patient contact and observation. There is no single lab test that makes a diagnosis of movement disorders. You have to know the clinical features. Now, it's an evolving field, it's a developing field, and as the population is aging, one of the movement disorders called Parkinson's disease is becoming more common. Patients are living longer, requiring specialty care. They need some kinds of surgery, they need different kinds of medications, and there are not many movement disorder centers in the Southeast. In fact, ours was the first one in Georgia. Movement disorder surgery is a very specialized procedure. First of all, the patient has to fit. It's not for everybody. The patient selection is vital. Then the next thing is the target selection is vital, and that's very hard. Brain is a very complex structure, and you are blindly trying to find a very small collection of nerve cells without actually seeing them. You record electrically, but you don't see them. So it requires 3D imaging and computer monitoring and things like that, and that takes a team. And not every hospital is equipped to do deep brain stimulation surgery, and therefore they have to come to a very specialized center. You have to form a relationship with the patient, not only the patient but the family. You've got to know the patient as a human being, as a living person who has a history, who has a future. You want to know about their interests outside of their illness. I mean, they are interested in getting better, but what else they like to do? How can I make them do it better? And because the movement disorders are chronic illnesses, not like going in there doing a simple surgery and moving out, you form long-term bonds. I have patients that are diagnosed in 1985. We've grown old together. And there's no other field, I think, in neurology that you form such a long-term relationship. And I think my philosophy of care is that every patient is an individual and should be treated as such. And they need to be treated with compassion, empathy, and respect. And I think that should apply to all branches of medicine, but I think especially true in a chronic illness that's going to be with them for the rest of their life.